Welcome to my channel. After conception, every pregnant mother needs to undergo some basic tests in addition to ultrasonography. Among these tests, one very important is hemoglobin test. If there is not enough hemoglobin in the body during pregnancy, it can cause problem in the brain and bone development of the fetus. Hemoglobin in the blood carries oxygen throughout the blood and removes carbon dioxide. It also transports various micronutrients. It is essential for those planning to have a baby or who are already pregnant to maintain a normal hemoglobin level in their blood. However, often we do not realize when our blood levels are low. So, in today's video, I will discuss with you number 1, how much hemoglobin should be there in pregnancy. Number 2, why does hemoglobin decrease during pregnancy? Number 3, what symptoms appear when hemoglobin level drops in the body? Number 4, how can you increase your hemoglobin level during pregnancy? So, let's get started. Before that, we need to understand what is hemoglobin. We know that there are 3 types of cell in the blood: white blood cell, red blood cell and platelets. Red blood cell contain a compound called hemoglobin. It is because of the presence of hemoglobin in the blood that it appears red. A decrease in the amount of red blood cell or hemoglobin in the blood is called anemia. Why is hemoglobin so important during pregnancy? When a woman becomes pregnant, her body needs various micronutrients, including iron increases. If there is a deficiency of hemoglobin in the mother's body during pregnancy, it can hinder the physical and mental development of the fetus. The baby's weight might be low, and if there is a lack of hemoglobin during the first 3 months of pregnancy, the baby may be born with congenital defect. Additionally, there is a risk of premature delivery and the baby's immune system may be weak. During delivery, the mother's body loses blood, and if the hemoglobin level is low, the mother's life can be at risk. Therefore, it is crucial to maintain adequate hemoglobin level in the mother's body during pregnancy. Normal level of hemoglobin. Adult males 13 to 18 mg per deciliter. Adult females 12 to 16 mg per deciliter. Level below this range are considered anemia. If hemoglobin drops below 8 mg per deciliter, a blood transfusion may be necessary. Now let's discuss why does hemoglobin decrease during pregnancy. There are generally 3 main reasons for anemia or low hemoglobin level in the human body. Number 1, blood loss. Sign: red blood cell and hemoglobin are part of the blood. Any cause of blood loss will lead to a deficiency of blood cell and hemoglobin, resulting in anemia. This can occur due to accident, piles, hemorrhoid, any surgeries, or excessive menstrual bleeding in women. Understanding and addressing these factors are essential, especially during pregnancy, to ensure both mother and the baby's health. Number 2, problem with red blood cell. Congenital issue like thalassemia. Number 3, deficiency of iron, folic acid and vitamin B12. Folic acid and vitamin B12 are necessary for the production of red blood cell. We got vitamin B12 and folic acid directly from our diet. If you do not consume enough food rich in these nutrients daily, a deficiency may be occur, especially in vegetarian. After eating, vitamin B12 and folic acid are absorbed in the small intestine. If someone has digestive problems such as irritable bowel syndrome, it can lead to deficiencies in these nutrients. Understanding this cause is crucial for maintaining adequate hemoglobin level, especially during pregnancy, to ensure both maternal and fetal health. Additionally, parasitic worm infestation can also cause anemia. Some medication, particularly those for treating gastric problem, can reduce the iron absorption in the body. People who take excessive amount of gastric medication may develop anemia. During pregnancy, many mothers experience anorexia, nausea, vomiting, and gastric problems, which can lead to deficiency in the iron and vitamins. Moreover, the iron requirement in a mother's body increases during pregnancy. On one hand, there is a high demand for iron, and on the other hand, there is a difficulty eating adequately. This is why almost every pregnant woman experiences some degree of hemoglobin or blood deficiency. How to identify if you have anemia? You can identify anemia by symptom and also by a diagnostic test. First, discuss the symptoms. Constant fatigue or tiredness, feeling weak, palpitation, shortness of breath with minimal exertion, cold skin, mouth and lip sore, brittle nails, chest pain or shortness of breath, and pale skin. Diagnostic test. CBC or complete blood count test or hemoglobin percentage test can directly indicate the anemia. If the hemoglobin level is below 11 mg per deciliter, it is suggest anemia. Monitoring the symptom and getting test can help identify anemia early, allowing for timely intervention and management, especially during pregnancy. How can you increase your hemoglobin level during pregnancy? During pregnancy, increasing hemoglobin level in the body can be achieved through several methods. Number 1. The first method is consuming iron-rich food. There are certain foods that increase the amount of blood in your body. Generally, red leafy vegetable, spinach, plantains, flower, beets, and green colorful vegetable contain irons. Despite regularly eating this, many people do not benefit much. The reason is that the iron has two types, heme iron and non-heme iron. Non-heme iron can be obtained from the leafy vegetable and fruits. When we cooked leafy vegetable, most of the iron is lost. That's why our iron deficiency increases and blood weakness is observed. So, fruits are the best option alongside the leafy vegetable. Among fruits, pomegranates, bananas, ripe papayas, tomatoes, strawberries, etc. contain a huge amount of iron and vitamin B12. On the other hand, food like beef, mutton, liver, eggs and seafood such as almonds, which are the rich in protein, contain large amount of iron which helps to reduce anemia. With all this food, vitamin C rich food are like lemon, orange and amla must be eaten, no matter how much iron rich food you eat. If you do not eat vitamin C rich food, the hemoglobin in the body will not increase because vitamin C helps absorb iron. So, eat 2 to 3 types of fruits daily to meet the demand of our other vitamins also. We need 1 to 3 microgram of vitamin B12 daily, and the boys need 8 mg while girls need 14 mg of iron daily. Additionally, during menstruation or pregnancy, the demand of increase about 27 mg. During menstruation, girl lose about 1.5 mg of iron daily. So, they need more iron-rich food than usual. Additional iron and vitamin B complex tablet can be taken directly. The doctor recommended taking iron medication almost all the time during pregnancy, although after that many people's hemoglobin decreased. In addition, direct iron injection are often given. Sign iron injection have more side effects. So, iron-rich food are the best choice for increasing hemoglobin during pregnancy. Remember, anemia is not a disease. This is the symptom of the disease. So, be sure to consult a doctor without delay if symptoms of anemia appear. No more today. I hope today's video was helpful for you. If you find the video helpful, do not forget to share it with your friends. Please subscribe to my channel for get health advice, health awareness and reproductive health related all the videos, and remember to become a member of our family. Stay with us healthy and safely. Thank you for watching this video.